Today we have Dr. Aditi Sethiya, a renowned homeopathic doctor with us. She has completed her BHMS degree from Dondu Mama Sathe Homeopathic Medical College. Today, she is going to guide us about the different opportunities in homeopathy field. Now let's hear from Dr. Aditi.
So there are a considerable amount of changes in terms of syllabus or opportunities for BHMS students and aspirants. Right from the syllabus, if you say, a lot of inclusion and opportunity for research has been there. After BHMS, opportunities like working for research companies or then for life insurance policies, or also at various institutes of nutrition or hospital administration with a diploma degree or a certified degree. These are the changes. Along with the degree, also there are a lot of changes in terms of including psychology or including parts of counseling, which is very important in homeopathy, and this adds on to the field of homeopathy and increases the scope of homeopathic doctor. So after your 12th, when you complete your 12th exams and your entrance, if you want to opt for homeopathy, then after your BHMS, the career in this career is very engaging, you can say, or very enriching, because there are a lot of different dimensions to homeopathy. Every pathy has a way of coming or reaching to a medicine for a patient. In homeopathy, you understand the patient who is suffering from that disease or who has that disease, and give the medicine not for the disease only but for the patient and the disease. So you have, every day is a new day and a challenge in terms of attaining the patient, having a rapport with the patient. So this in itself is a big opportunity for all the people who want to opt for homeopathy. So after your 10th, you choose for science as a stream. 11th, 12th, you will be doing science, and after that physics, chemistry and biology are compulsory for any medical stream and also for homeopathy to get entrance for homeopathic admissions. So after your 12th, when you want to take admission for homeopathy, the degree name is BHMS, that is Bachelors of Homeopathy and Medical Science. Okay, so after 12th, you have to give an entrance exam, and on basis of your 12th marks and your entrance marks, you get admission for homeopathy course. So this course is now for 5.5 years. After 5.5 years, which includes 4 years of academic training and detailing, it's 1 year of internship. So after this 5.5 years, you complete your graduation and you are now then titled as an homeopathic doctor. So this in terms is of BHMS, that is a graduation course. Speaking of post-graduation, again after BHMS, you are supposed to give an entrance exam, on basis of which you get admission for post-graduation. Now post-graduation is of 3 years of duration. There are two parts, part 1 and part 2. In these 3 years, you can do your MD or you can do your masters in various subjects like homeopathic materia medica, which is which we can relate to homeopathic medicines and its use, its source, its making or pharmacology of homeopathy. Then is homeopathic philosophy, which is the basis of homeopathy, the scientific part on which homeopathy is based. Then there are other subjects like skin, psychiatry, or then repertory, which is also a very important tool to understand the homeopathic medicine and come down to a specific medicine for an individual. So these are the various subjects: medicine, homeopathic philosophy, homeopathic materia medica, psychiatry and skin and pediatrics. These are the subjects in which you can do your MD. And after MD or along with these subjects, you have research also in the MD curriculum. So you can also do a research on whatever interest is of yours. After your 11th and 12th, when you want to take admissions for BHMS, at that time you need to have at least 50% passing for physics, chemistry and biology aggregated, and after that you need to give an entrance test, which now all over India is conducted as National Eligibility cum Entrance Test, which is NEET. And the syllabus for NEET is the same as what you have for 11th and 12th, which comprises of physics, chemistry, biology, and this exam also you have to pass with minimum 50%. That is for the general category. For caste or any other category, you need minimum 40% passing for your entrance test and also for 12th marks. Also, if you have to prepare for your NEET exams, you can of course take help of the classes which are available, but you need to understand and you need to do good amount of self-study and prepare properly for your NEET exams with the help of whatever syllabus you have for your 11th, 12th of physics, chemistry and biology. So there are about 50 to 60 colleges in Maharashtra for homeopathic colleges for BHMS. In Pune, if you ask, there are a few colleges like Dhondu Mama Sathe Homeopathic Medical College or Bharati Vidyapit College of Homeopathy and D.Y. Patil College of Homeopathy. So these are the few colleges which are there, which function fully and which are very reputed colleges, which are there standing tall for around 20 to 50 years. So these are the colleges in which you can enroll and take admissions. So as I said that the course is of 5.5 years. 4.5 years are of academics, in which you have preclinical, clinical and postclinical, paraclinical subjects. Preclinical, you have anatomy, physiology and homeopathic pharmacy, and also you have homeopathic philosophy, homeopathic materia medica, which are the core subjects of homeopathy, which are there for all the years, first year, second year, third year and final year of BHMS course. Now along with this, as you go ahead, you have subject of pathology, subject of forensic medicine and toxicology and surgery and gynec and obstetric subject and practice of medicine. Repertory is also one of the homeopathic subject which is there for almost all 4 years. It is taught for 4 years. At present the exam is given only for 1 year. This is about the academics. After completing 4.5 years of academics, you have 1 year of compulsory internship where there is hands-on or field work or experience which is taken by seeing cases, by taking cases, by administering medicines to all the patients, and after the completion of this 1 year and certification of this 1 year, you complete your BHMS degree. So this is about BHMS, like I said, and for post-graduation it is for 3 years, which is divided in 2 parts. You can choose the subject during your entrance exam, after which you do an MD. Suppose if you do MD in practice of medicine, so you have practice of medicine as a compulsory subject. Then there is an integrated homeopathic subject by the name ATFH, and after that you have research and research methodology and biostatistics as a compulsory subject. So this is for post graduation, and along with this you have compulsory IPD and OPD duties for all 3 years. So practice outside India is depending according to the country which you will travel to. So you have to get your degree affiliated to the country and its universities. If that is not the case, you can do other degrees like 1-year degree in nutrition or in other health, allied health sciences, or for example in naturopathy, and then practice. There are a few countries which give homeopathic medicines as natural medicines or herbal medicines. So you need to get the full information, which you can of course get it online, and mostly you need to have a word with those who are already practicing there and get information and then see if you can practice in that particular country. So you can do a job or you can practice after completing your BHMS degree. You can also start seeing patients after completing your BHMS degree. So private practice is an evergreen option. You can continue it anytime. Other options are, with the need of time nowadays, there are a lot of BHMS doctors pursuing nutrition courses or doing psychology courses, so that they can also help in counseling or nutrition and dietetics. These are 2-3 areas. Along with that, there are other jobs like working with insurance companies, so as to help them to collect data, verify data. And also in terms of research, with different research companies or firms, you can work and you can help in data collection and data analyzing or data verification. So after BHMS, you can opt for courses like dietetics or nutrition and dietitian courses, or then there are post-graduation diploma for psychology and for hospital administration also, where if you are interested to work in an hospital and have those administrative qualities, you can do the post-graduation diploma, post-graduation course for hospital administration, and then you can work in hospitals as for execution or for administration. So it is commonly asked if you can prescribe allopathic medicines along with homeopathy. According to law and according to the degree that you hold, you cannot prescribe allopathic medicines, though you need to have a complete knowledge of those medicines, because many times a lot of patients come to you taking those medicines. So in short, you cannot prescribe those medicines. In cases of emergency, yes, you can, but in day-to-day practice, you cannot. Also, those who are really keen on practicing allopathic pharmacology, they can search for a course which has been started by MUHS, and which is about 6 months to 1 year course of allopathic pharmacology. And after getting the completion and certification of that course, you can practice or you can give allopathic medicines. But for the degree of BHMS, you cannot give allopathic medicines. So speaking of the advantages of homeopathy, this is a system of medicine where the medicine is given with a message. When you are giving homeopathic medicines, you are also to understand the patient's psychology and the mind of the patient, how he is reacting to this specific disease, what he is suffering from. And this is the crux of homeopathy. So the advantages are that you get to know people, you get to know different types of people, and you have to deal or try to deal with these kind of people in your practice. The disadvantages being that when you are in your early days of practice, there is a lot of competition with other pathies or in the pathy with other doctors. So if you ask for settlement, you have gradual settlement. In other jobs, you get immediately you get a job and you start working. Here your practice you have to develop, which takes some amount of time for settlement, and that is the only, maybe you cannot call it as disadvantage, but a time span which is consumed for your practice to begin. After that, if you are going to practice, it is throughout there is an advantage of doing what you really want, that is serving people or being helpful to people by giving these medicines. So during the phase of pandemic, it was seen that there was a demand of doctors and physicians who were needed to work besides their degree. So in such cases, homeopathic doctors were also called to work in hospitals and COVID hospitals, and this was a great opportunity for homeopathic doctors. Also, understanding or having a doctor by your side for every stage of corona that we were going through, homeopathic doctors made it a point to still continue their OPD in spite of a lot of debate on the level of the legal issues. So there were a lot of OPDs open, and which were allowing doctors with all the hygienic pre-hygiene or all the hygiene maintained and with all the safety measures, the doctors were seeing their patients. And it is needless to say that homeopathy has worked equally well like the other systems in terms of the pandemic, even in COVID and even in other pandemics like swine flu. So, what kind of skills are required as a homeopathic doctor? When you are dealing with patients, it is not only the disease that he is suffering from. We all suffer from a common cold, or we all suffer, there are a lot of people who suffer from acidity. But everybody has a different expression or a different way in which their disease comes out. So, homeopathy takes into account the disease and also the person who is suffering from this disease, and which is why we need to have a good skill of communication about how do we understand the patient, how do we deal the patient. If there is a patient who is not talking much or who is talking a lot, how do you understand and deal that patient, how do you guide that patient? And along with this, there are a lot of diseases like diabetes or hypertension or corn or any disease that you name where homeopathy is effective. But it is not only getting the disease and the medicine together, it is more about understanding the person who is suffering and trying to give a right medicine to that person. So, the advantages of technology in terms of homeopathy is there is a subject called repertory which is used for analyzing or for dealing with the patient's signs and symptoms. Earlier, it was a method to go through all the books, all these books and come down to a medicine. But now with the use of technology, there are softwares available with the help of which we can come down to a remedy very quickly and help the patient from waiting for a very long time. Also, in terms of investigations, there are a lot of new technologies, but they are there in all the fields, and homeopaths are also taking or making use of it. So, I give you a lot of best wishes to have your career in homeopathy, because there are a lot of opportunities in terms of dealing with patient, in terms of handling various emergencies or various OPD based emergencies also. And as you enroll for the BHMS degree, you will understand with what volume and with what variance you have these opportunities in terms of your practice in other jobs. And for all of you, I wish you a very good luck and best wishes from my side for having a career in homeopathy.
Summary. Changes in last 10 years. Syllabus. Research opportunities have increased. New areas to work after BHMS, such as research companies, insurance companies, institutes of nutrition, hospital administration, have increased. There has been an inclusion of psychology counseling in homeopathic practice. Education. In science stream, physics, chemistry, biology is compulsory. Eligibility is at least 50% marks in PCB, that is physics, chemistry and biology. For BHMS admission, there is an entrance exam after 12th standard called as National Eligibility Cum Entrance Test, that is NEET. For preparation of entrance exam, students can take help of classes. Self-study is must. BHMS course duration 5.5 years. First 4.5 years of academic training such as preclinical, clinical, paraclinical subjects and 1 year of internship, hands-on or field work. Total 50 to 60 homeopathy colleges are in Maharashtra. There are 3 colleges in Pune: Dhondu Mama Sathe Homeopathic Medical College, Bharati Vidyapit Homeopathic Medical College, Dr. D.Y. Patil Homeopathic Medical College and Research Center. Post-graduation is of 3 years. There is a separate entrance exam for post-graduation. There are 2 parts in the post-graduation. Masters in subjects like Homeopathic Materia Medica, Homeopathic Philosophy, Skin Psychiatry, Repertory, Research, Pediatrics field are available. Compulsory IPD and OPD duty for all 3 years. New postgraduate diploma courses for psychology, hospital administration are available. Career opportunities: private practice, counseling, nutrition and dietetics, Work in research companies or insurance companies for data collection, data analysis, data verification. For prescribing allopathic medicine or practicing allopathic pharmacology, one has to complete a course on allopathy by MUHS. Practicing outside India. Degree should be affiliated to the universities in the country. If degree not recognized, complete additional degree course in that country. For example, 1-year course in nutrition or naturopathy or allied health sciences. Some countries recognize homeopathy as natural medicines or herbal medicines where one can start practice. Advantages. You would get to know different types of people. Disadvantages. There is lot of competition. Time required for settlement is more. Skills required. Communication skills, empathy.